One of the biggest things that people don't understand about vulnerable communities or people in poverty necessarily is that the biggest resource that they lack sometimes is relationships.
We're here at Outreach Counseling Center in York Township. This new space was made possible through the Endeavor Health Community Investment Fund.
We had seen some community needs assessments that identified behavioral health services as the priority health need in this community and a top concern.
And so when the Community Investment Fund became available, it was like perfect, right? Like it was what we needed. We knew that we wanted to attach counseling to the community center. We just didn't have a way to do it yet.
Outreach has such a commitment to supporting the holistic needs of the surrounding community. In fact, just a few minutes away, you'll find Outreach York Neighborhood Resource Center.
One of the things that we are really intentional about is listening to communities and what they need. So when I think about what's so good about having a community center and a counseling center walking hand in hand, is it really reminds us that the work that we're doing is holistic.
At the Outreach York Community Center, we have after-school programs that help students with academic support. We also offer adult services, which is our case management program, and our case management program offers assistance to families that are in a crisis that need help to stabilize.
And so as the teachers at the community center and staff there have conversations with students or their families and recognize there might be a need for counseling, they can easily say, hey, you know, Miss Jess, who comes on Mondays and does our social emotional learning class, you know, she works at the counseling center and you might be able to see her.
It's super scary to talk with a therapist, but knowing that somebody else knows this person and that they're trustworthy and that they're connected to your community changes everything right away.
It's such a privilege for us to be able to know that when we're working with a client, that if they do have other needs, for example, they're in a financial crisis or they need access to food or to be able to maintain their housing and utilities, that we can just quickly reach out to a colleague, our case manager, to get resources and information, either referring them to our case manager specifically, or even us just learning more ourselves and being able to impart that information to our client.
Part of who we are and what we believe is that a community has its own spirit about it, right? The community has its own resources, they have their own people, they have their own needs, they have their own strengths. And so really what it means to be a community mental health center is understanding what are those strengths, what are those resources inside that community.